Last week I went through what to do immediately after a hysterectomy with some basic core exercises. Now I'm going to focus on the progressions and just go into a bit more detail into what to watch out for with regards to preventing a hernia. Now the key thing with any tummy pressure related core exercise is that we don't want our stomach to dome, so we don't want to see it inflate, and we also don't want to see our back come off the bed too much. You should only ever have kind of one hand width between your back and the bed. So in this position we're going to take a nice deep breath in, and as we do so arch our back, exhale, pull in and flatten our back. Inhale, arch, exhale, rock in. And then from this position we're going to go into a spinal roll bridge. So rocking our back into the bed, so we're flattening our back, and then very gently trying to take one vertebrae off the back as you can, up into the air. And what we want to feel is a light pull of your belly button towards your spine, and then slowly, and again one vertebra at a time, place your back on the bed. The second thing we're going to work on is that hip out to the side, that hip abduction, but we're going to take it up into single and double tabletop. So when you're doing this, keep one hand on the bottom of your rib, one hand on the front of your hip, and really it's just to make sure nothing's twisting. If you feel one side is shifting, we know we need to just go down a level. So inhale, draw your knee to 90 degrees at the hip. Exhale, take it out to the side, but as far as you can without feeling your body pull towards it, which may not be very far. Inhale, back into the middle. Now this is nice, stable and controlled. If you feel ready to take it up a notch, we go into what we call double tabletop, so it's both knees in the air. But when we do this, this stomach needs to not rise. If at any point you do this or this with your belly, you need to go back to that single tabletop or no tabletop position. So in double tabletop, the exact same thing. Everything stays held, one hand width between the back and the bed. Inhale, hold. Exhale, move. Inhale, hold. Exhale, move. And then the final movement is that heel sliding movement that we were doing, but we're going to hold again in single and double tabletop. So inhale, hold, 90 degrees of the hip for single tabletop. Exhale, take your foot away. Inhale, draw it back in. And when you feel ready, progress, but again, no doming, no arching at the back, nothing is moving here. Inhale, hold. Exhale, take it away. So there you are, the key progressions to work on your core post-hysterectomy. These level of exercises you might be able to do around about 2 to 3 months post, so there is no rush. You'll be surprised, even though you think the surgery is small, the internal damage and the healing that needs to be done takes time, and it is really, really important. Once you get a hernia, you can't undo that hernia, so it's about making sure that foundation is there before you try and work up the levels.